Hi, Dr. Shekhar. Welcome to DocTalks podcast. So, this is the first episode of DocTalks podcast. Thank you so much for giving your time of the day.
Hi Ansh, how are you?
I'm absolutely good. How are you?
I'm good here.
So, yes, we have Dr. Shekhar here from Australia. We can have a brief round of introduction. Dr. Shekhar, you want to take it up?
Okay, thanks Ansh. Thanks for inviting me. So I'm presently in Indonesia. I came for a conference. Yeah, so basically my journey, it's been 16 years, when I started dentistry. So my story is like I'm born and brought up in Delhi. I finished my schooling in Delhi. At the age of 18, I went to a south part of India, which is Mangalore. So I studied in a Manipal University. I did my Bachelor of Dental Surgery from 2001 to 2006. And then I wanted to pursue my master's. So I did my master's in endodontics, which is basically like a root canal specialist. So I moved to Mysore in 2007. And from 2007 to 2010, I was in Mysore. And then as any other student, I finished my master. I want to come back to my hometown. I wanted to start my clinic and basically start my journey in Delhi, my hometown. But things doesn't work like how you think. So I actually worked for 2 years only in India, and then I got into Indian Army. I was selected for a captain rank. So basically, the story is like then I got married and then I couldn't continue my army journey. And then I moved to Malaysia. So then I worked for 12 years in Malaysia, worked in different universities. And 2023, I moved to Australia. So I'm presently working in University of Queensland. I'm working as a faculty in endodontics. So I'm in Australia right now, presently.
Okay, so as you mentioned, like the journey of you studying in India in the southern part has a span of over 9 to 10 years. So to be as a 18-year-old student who just left his house, what actually motivates someone, to study for the next 9 to 10 years and devote that kind of time into something?
Okay, it's a very good question, and people have asked me this question so many times. And I don't know whether you believe it or not. I always wanted to be a dentist. My journey started, I think, probably at the age of 5 or 6. So my Nanaji, he always wanted me to be a dentist. And so there were two role models in my life. One was my daddy. I used to call him daddy. So he was my Nanaji. And then my mama. He's in Dubai. He's based in Dubai. He's an orthodontist. So seeing two people in your family, one is dentist and one is an army. So my two goals in my life was to be a dentist and to join army. So they motivated me a lot. So that was a driving force. So I remember when I was like very small, people used to ask me what you want to be. So I always used to say I want to be an orthodontist. So but I never knew who's orthodontist. I just know that okay, he's something like who treats teeth. So there was nothing second thought in my mind. There was no second profession in my mind. I've never thought about any other profession. The only thing what I always used to remember, I always want to be a dentist. There's no other second thought. I've never thought about any other profession in my life. So my driving force, as I mentioned, was two important people in my life. Yeah.
And as you mentioned that you are an endodontist and your role model, which was your uncle, is an orthodontist. So for the
Yeah.
audience, what is an endodontist and what is an orthodontist?
Okay, so basically in dentistry, there are a lot of specialization. So endodontist is basically who performs root canal treatments. Okay, so if you have heard about nerve treatment, probably in a simple language, you have a deep decay in your teeth, and a patient comes with severe pain, and you need to do something called a nerve treatment. And nowadays you have aligners and all that. So this is done by orthodontist. So that's the difference. So as I mentioned, there are many other branches. Some people, some wants to be a gum specialist, so they are called periodontist. Then some wants to pursue masters in specializing in kids, children's and all that.
Okay. So in your journey of the 10 years where you're actually studying your dentistry, where exactly you get an option to become either an orthodontist or an endodontist?
Okay, so basically my time when I was pursuing, so the rule is very simple. You have to finish your dentistry. So in India, according to Dental Council of India, you need to finish your internship. So that's the last part of your BDS. It's a compulsory service. Everybody has to do that. We need to have an internship certificate. So in internship, basically we work in different departments. Once you finish your internship, then everybody has to study for the entrance exam. So there's an entrance exam. It's a, you can say, like almost like a 9 to 10 months of hard work. You need to crack that exam. And my time when I was doing it, different universities different bodies have different exams. But nowadays they have only single exam. So you just need to give that exam. It is called NIT. And then once you get a rank, then there's a counseling, and then you can choose your branch or a college or university depending upon your rank. So it's like a central counseling. So yeah, so this is how it works.
Back in your time, how were the examination patterns?
It's a multiple choice question. So some exams are like 200 MCQ questions, some are 300, some are 100, depending upon which kind of bodies that they're conducting the exam. So I was very fortunate, very lucky. I cracked almost all my exams. I got seventh rank in AIMS, which is All India Institute of Medical Sciences in Delhi. But I couldn't get that seat because at my time there was only 5 seats. So I was second waiting. So I couldn't get it. I got 100, 1 to 9 AIPG. Then I got sixth rank in KSET, which is Karnataka CET. So I actually took my seat through KSET. So sixth rank. I got Comet rank 29th. I got Manipal rank 4th. So basically, when you are studying, you are in flow, you can understand your subjects, and you can actually probably crack a lot of exams. So my time, I was very fortunate that I cracked all the exam. But ultimately, you need to only choose one university and you need to choose one
Right.
body. So I choose KSET in my time.
Okay, and which college did you pursue from that case set?
Okay, so my counseling happened in Bangalore. I was the first person to choose endodontics. So I was a sixth rank, as I mentioned. So I choose endodontics, and then I went to Mysore. So the university where I worked, the college where I worked, was JSS Dental College and Hospital. It's in Mysore. My time, it used to come under Rajiv Gandhi University of Health Sciences, which is Bangalore. But now it's a deemed university. So it comes under JSS University.
And so you have taught and practiced endodontics across India, Malaysia, and now Australia as well. So, how was working in such diverse healthcare systems shaped your approach towards dentistry and teaching both?
Okay. Yeah, Ansh. So basically, as I mentioned, the when I finished my masters, I joined one university and I was working in that university as an academician. I was working as a senior lecturer. Working because I came from south part of India because my studies were all in south. So I came to north. So there was a difference between north and south. Yes, how the dentistry is taught, there is a little bit of difference. Yes, but more or less, the subjects are same, everything is same. So I started working, and then I moved to Malaysia. So Malaysia was different from India, definitely. I learned a lot of things. The university where I joined, it's called Masa University. It was based in KL, Kuala Lumpur. I worked for 2 years in that university. Learned a lot of things. Gained a lot of confidence. Met so many different kinds of people. So when you move to different places, you tend to learn so many things. Correct. Everybody has their own way of thinking. Everybody has their own way of teaching. So I have always made sure. I think I'm a good observer. I try my best to learn from others. Good experience, excellent experience. 2 years, as I told you, I worked in Master University, and then 10 years I worked in International Medical University, which is again based in KL. So it's a journey. I still feel, now I moved to Brisbane. So I think I try to learn every day. You learn every day different things. You improve yourself and keep doing. This is what I'm doing for last almost 15 years, 15 and a half years.
That's actually inspiring. And so, coming on to root canals, since they have been a major part in your practicing, so root canal treatments often scare people. So, could you break down what actually happens in a root canal and why it's not as intimidating as it sounds?
Okay, so I think overall, all over the world, as I mentioned, I have worked in different places. I think the overall mentality is same. People are scared of dentists. But I always say we are good people. We are not bad people. Okay, people come with pain, and so when a patient comes with pain, so basically we need to do something. We need to relieve the pain. Okay, I don't know whether you have experienced dental pain or not. It's really bad. I have experienced myself, so I can tell very confidently it's not a good experience. Okay, so when your patient comes with severe pain and you need to do something. So most of the time what happens is patient is having pain because the tooth is having a deep decay, and it's very, very close to the nerve, and we need to do something. So what we have to do something is we need to start some kind of nerve treatment. So that is our branch. So we basically relieve the pain, though the patient is in pain. So we make them understand that you are coming with pain. We want to relieve your pain. Okay. So it's so we need to give local anesthetic, we numb that area. So that whole journey might be a bit frightening for patients. They're anxious that something is going to happen, but when they go through it, they feel, much better, so if you don't experience that, obviously you will never understand. So I think, but more or less, to summarize, I think you don't need to be scared of dentists. Okay, we are good people.
I mean, so if you have to mention about any one technique, so since you might have dealt with a lot of anxious patients, so when they come to you, they often either are in pain or very anxious about coming to doctors with the perception in mind. So what do you as a doctor, as a practitioner, do to comfort them, or any one technique you want to tell about that helps them calm down?
Okay, it's a very, very important topic, Ansh, because I think in medical field or in dentistry, I think it's very, very important to communicate with your patient. Okay, if you communicate, if you make them understand basically what's going to happen and why the patient is having pain, they understand. You need to show a lot of empathy. I think that is a part which I feel lacking somewhere. We need to improve that. I have worked in that area for almost 12 years. I used to conduct a workshop which is a dentist patient interaction and communication skill workshop. It's one of the workshop which prepares doctors or dentists, for their part 2 OSCE examination, Royal College of Edinburgh. So I think I have learned myself so much, while doing this workshop, that the communication is so important between a dentist and a. So I have realized over the years, when you talk to them, when you make them understand in a simple language, they understand, and their anxiety level goes down. They understand, what's going to happen. But if you don't make them understand, you'll just give them like a shock. Okay, I'm going to open your mouth. I'm going to give you injection, something like that. They'll be obviously frightened. So I think that's a very important. By just having a simple communication with them, you can reduce their anxiety.
Great. And, since you mentioned the part that a doctor has to communicate well with the patient, which means there is a bond involved, the understanding between the patient and a doctor is involved. So, what do you think? There are a lot of doctors in this field having experience over 10 to 15 years. What differentiates one doctor from another in, in context of connecting with the patients?
Yep. I think the most important thing what I feel is your empathy and you can say your passion. Okay. I have seen so many different kinds of students and all that. I think you need to understand that this field is, it's not a stagnant field. Every day things are changing. There's so much of new techniques are coming, new materials are coming. The dentistry is evolving every day. Okay, and we need to be in par. Okay, you can't say what I was doing like 20 years back, I'm just going to continue. No, you need to unlearn things, relearn new things, read more, correct? Learn from your peers, learn from wherever you're working in any clinic. So what I'm saying is, in dentistry you can learn many things by just observing people. Okay, so you can see how people talk, how the other dentists talk, pick up one point which can help you to improve or make you a better clinician. So this is what I feel, you need to keep evolving. You can't.
And I believe you have also traveled across multiple countries, have had met a lot of doctors with diverse backgrounds, diverse degrees even. So what do you think is a one common problem or per se one thing you noticed which makes them lack this particular skill of either empathy or this connect, that they lack a particular thing while practicing their degree or endodontics or practicing being a dentist? So, what is one common thing across countries which they lack?
I think, Ansh, this question is again very important because it depends upon where are you working. Because if you're working in a public sector or you're working in a private sector, things are a bit different, correct? When you're in private sector, you're in a private clinics. You tend to be a bit faster, because you need to finish a lot of patients. Money matters economically. The clinic has to be in. They need to, because there's a lot of financial things comes in private sector as well. So you tend to be a bit fast. When you tend to be a bit fast, you don't spend so much of time with communication. Correct? Your patient is there. He's in pain. You just need to give LA local anesthetic, open the mouth, drill it, and remove the nerve and start doing root canal or whatever. So you are a bit fast. You don't spend that time in communication. I think as I mentioned, I was very fortunate where I have worked. The time was never a factor for me. I've always believe in quality. Even if it is taking a little bit more time, I'm okay with that. As long as I make my patient comfortable. So I think I have seen many people saying the same thing, doctor, how can you spend like 20 minutes in just talking to the patient? I said, you need to spend that that initial 20 minutes or 25 minutes, whatever you say, it depends, sometimes maybe 10 minutes, sometimes 15 minutes, sometimes, because every patient is different. You need to understand the psychology of your patient, correct? Some patients might need more time. They need more time to make them understand. We need more time to make them understand, correct? Every patient is not same. So I think this thing is a bit lacking with young people. They want to be very fast. They don't have that patience. They want to finish things faster. I think the answer is very simple. You need to slow down and understand your case. Don't rush. It's a lifetime bond. I still have my patients who keeps on messaging me, calling me. I have seen them like 4 years back, 5 years back. I have done a lot of patients from Singapore. They used to come and travel to KL. Still in touch with them. They keep on messaging me, doctor, how are you? So it's a bond. And I always say, if you have done good work with your patient, they will never go to another dentist. It's like a bond. I have so many incidents where I have done a root canal for a patient from Singapore, and Singapore and KL is almost like 5 hour journey. And after 1 year or 2 years, they want to come and see me, and I asked them, is there any issue? He said, no issue, but we want to just come and see. I said, I have a lot of my students who are working in JB. So JB is called Johor Bahru. It's a border between Malaysia and Singapore. So I know a lot of doctors in JB. So I used to tell them, why don't you just go to JB, because it's a regular checkup. It's very easy for you, just a half an hour journey. Why you want to travel from Singapore to KL? Correct. But they will not go anywhere. They'll still come back to KL only, just to come and see me, or have a simple regular checkup, and I can finish that checkup in like 15-20 minutes. But they will come and travel from for 5 hours. So why they do that? Because they trust you, correct? So this is a trust factor. So which doesn't come in one day, it doesn't come in 2 days. It comes with time. It comes with a lot of hard work. So as I mentioned, I was very fortunate, where I have worked. My patients were good. They trusted me, everything was good. So yeah, it takes time. So young people, I can just say, you need to show some patience. You have to slow down, don't rush.
And as you mentioned about diverse patients, is there any one patient or one case on the top of your mind which you still remember? Like one case which is like so different, maybe the bond, maybe the conversation, or the kind of person, or the kind of treatment you provide. One or two, whichever of the cases which you remember.
There are many cases, Ansh. There are many, many patients. As I mentioned, I've worked with so many patients. Every patient is different for me. Some are anxious, as I mentioned. Some are really wants to get the treatment done, but they are anxious. Some are just unnecessary anxious. So if I remember, there was one patient who has learned so many things about root canal from Google. Okay, I can't name that patient because that won't be right. So she's so anxious in a way. She's so inquisitive to know so many things because she has read from somewhere, correct? So I'm trying to explain them, and she's asking me questions as if like some dentist is asking me question, but she's not a dentist, correct? So I actually need to ask, are you a dentist? So she said no. Then I said, how come you know so many things? I have read so much. So there are some patients who are very concerned about their own teeth, and they go and read journals. They learn those techniques and keeps on asking why you're not using that technique, why you're using that technique, why you're not using that material. So yeah, so it's not easy patients. They are difficult patients. But yeah, there's so many cases like that where. So I remember this case. The reason is because I work with a microscope, correct? So most of the endodontists all over the world, they work with a microscope. So where I used to work, we used to have a screen in front, okay? And when your patient is lying down, they can't see that screen in the front, correct? So some clinics, what they do is they put a screen on the top. Okay. So where I was working, we never used to have a screen on the top. We used to have a screen in front. So she said that when you're working with the microscope, she wants to see the screen. Okay, so I said it's not possible because you are lying down and I can't allow you to sit like this because otherwise I can't work. But she wants it. Okay, so I need to talk to her and tell her, okay, I'm recording everything. I can show you the whole recording later. So as I mentioned, there are patients different kind. They're challenging. They want to know more, which is good. Nothing wrong in that, but they're difficult. Yes.
And as you mentioned, there's a screen, there's a microscope. Can you explain us more about the technology involved in root canal and the procedures and the processes?
Yeah, Ansh, basically as I mentioned, when we are working with root canals, when we're doing endodontics, we are working with a very small spaces. Okay, it's a very small nerve. Okay, it's like a size of your hair. Okay, now this machine basically this is a microscope. Okay, So, and it can enlarge that image many times. Like, it can go up to around 20 times, so I can see that small thing in a big size, correct? So I can see more clearly. So if I can see better, I can work better. So you can understand that. So the whole game change, when you are able to see in a magnified view, you can improve your quality of work. So as an endodontist, I need to work with a microscope. And it's a separate training. It's not that we teach it in undergraduate days. No, during BDS, students don't learn that. It's more towards masters. When somebody is doing specialization, because these are more specialized work. The good thing what's happening nowadays is, because my time when I was working, microscopes are very expensive. Right, so not every place used to have a microscope. Okay, nowadays the things are getting better. There is more variety. There are more companies, so the cost has come down, significantly come down, and people are more aware. They understand that if they working with a microscope, they can improve their quality of work. Okay, so I have seen so many general practitioners now, they want to learn the microscope, so we teach them, which is good. So the whole idea is the technology is improving. It's not only in endodontics, it's all over the dentistry. There are many things. You can do a single day crown nowadays. I don't know whether you know crown, like a cap. Our time, when I was, you need to take a size of the jaw, send to the lab. Lab will take another few days. Now things are getting better. You can even do in a single visit. We have a CAD CAM machines. You scan the tooth, put it in the milling machine, and within an hour you can get the crown done. The technology is improving day by day. So as I mentioned, it's basically different kinds of hardware, softwares. We have different types of gadgets. It's an integration of the technology. Like CAD CAM is not only used in dentistry; it is used in other fields as well. Microscope, you must have heard about microscope by in other fields as well. Like, ophthalmologist, if you have been to an ophthalmologist, they always see your eyes under something, that is a microscope, right? If you're going to ENT doctor, they also use some kind of microscope. If you're working, if neurosurgeon, if they're doing a brain surgeries, they use a microscope. It's something similar technology we as an endodontist also you need to use, correct? So the technology is there. It's just the diverse fields where it has been used now.
So, what is the impact of AI in your particular role and the technology?
Okay, AI, as you know, it's coming everywhere. So in our field, in medical field, in dental field, AI is helping us as well. In diagnosing your radiographs. Because AI, if you put all that information and give to the AI can actually see those images and come to the conclusion. So AI is a lot of AI technology is used in endodontics, specifically in reading your CBCTs. CBCT is basically, you must have heard about CT scans, correct? In medical field. So in dentistry also, in our endodontics also, we use the technology called CBCT. So basically like a three-dimensional, radiograph of that particular tooth. So in my field, in our field, when we are working with the tooth, with the root canal, the anatomy is very complex. It is not like a simple anatomy. So we need a CBCT scans. Okay. So AI is we use, if you give those images to the AI can, read those images, lot of data, and then they can come and pick up those information what we need. Okay. So a lot of diagnosing, lot of things what we can't see sometimes, AI can pick up. Okay, so yeah, so uh, AI is picking up in dentistry as well. So basically, there are different kinds of dentists. For like example, there is a dentist who's a general dentist. So he has completed 5 years, but he wants to be a general dentist. He doesn't want to pursue specialization because it costs money, it costs time. It's a commitment for another 3 years. So what they do is they finish their general dentistry, BDS, but they want to learn more. So, like example, a general dentist who loves doing a root canal treatment, but he wants to improve his skills. Correct. So what we do when I'm doing a workshop, basically I'm training them to be more better than before. Correct. So as I mentioned, we have different kinds of technologies like rotary endodontics, CBCTs, and all that. So we give them extra training to them in maybe in a 2 days course or 3 days course or a 1 day course. So probably they can be a little bit more better than before, and then they can go and practice. So these workshops are most of the time are for general dentists. For postgraduates also we do. So they want to, because as I mentioned, it is you need to learn from everyone, correct? So if somebody is doing a course, like even if I want to learn some specific thing in my field, I will go somewhere and learn from some person who has spend so much of time in doing that thing, correct? I'm not a master of everything, correct? I need to also learn. I need to also learn new technologies, new techniques, learn new materials. So even I go for the workshops as well. So as I mentioned, we need to learn from each other. So when I'm teaching general dentists, so I'm teaching them, they want to learn from me. So I want to teach them more advanced skills in endodontics so they can be a better clinician. Everybody can't do masters as well. So this is what
Right.
we do.
And everyone, like if someone is willing, having that expertise, not everyone is capable, or if not capable, does not is aware how to take those workshops. Because I believe organizing these workshops to be able to dissipate that knowledge which maybe a dentist have accumulated over the years, it's something not every dentist does. So what's the way for an experienced doctor to start their own workshops?
Okay, so Ansh, basically everyone doesn't do a workshop. The reason is it's again like a teaching, you need to teach people, correct? And it is not easy. It is not so easy. Some people don't like it. Some people are, I know so many dentists, they are excellent clinician, but they don't like to teach, correct? They don't want to
Right.
teach. Teaching, everybody don't like it, correct? So to conduct a workshop, you need a lot of planning. You need to have some experience in teaching as well, correct? So in my workshop, when I do a workshop, so I start from the scratch. So my workshops are more hand skill based, correct? Less theory, more skill, So people come and do practical work. So I give a lot of demos. I show them techniques. I show them instruments. I show them how to use that instrument, some tips and tricks. So it's like a teaching. I'm working with like 15 participants or 20 participants, in one big hall, big one room, and they are with me for next 2 or 3 days. It's a commitment. So not everyone don't want to do it. Everyone don't have that probably you can say that zeal to do that. So everybody is different. So not everybody wants to conduct a workshop. In a simple answer.
And maybe let's just consider the scenario wherein you have been in two professions, like both noble, one being a doctor, one being a teacher. So, what do you prefer if you have to choose one, either being a teacher or a doctor? Which one would you choose and why?
It's a very difficult question, Ansh, because honestly, I like teaching. I love teaching. That's why I'm in that field in 15 years. And I love my clinical work. So these are the two things which I love. And I'm very fortunate I'm doing both the things. So it is difficult to pick one. But if you really insist me to pick one, I love doing clinical work. I love being with my patients. That's always my first love, and difficult to remove that love. But the more I'm into my field, I want to share my knowledge as well, correct? So if I can be a good clinician, I feel I can teach better. So this is how it works for me. If I can't do myself, how should I expect my student to also do it? Correct? In a simple language. So I feel I need to be good first to make my students good. Simple. So I try to balance both the things. So if you want me to choose one, yes, I like to be more with my patients.
Got it. Okay. So, also, let's just say a general doctor is attending your workshop. What are the three takeaways he can expect after that particular workshop?
Okay, so whenever somebody comes and wants to learn from me, I think see, you can't learn everything in 2 days or 3 days. We can always guide you. I try my best to give as much as information as possible because I feel, if somebody's coming, somebody's spending their time and money and coming to our courses, it's my responsibility to make them learn as much as possible. Correct. So I always say then you have to pick up whatever the best you can do in that 2 or 3 days and then don't stop. You need to use that knowledge and skill what you have learned immediately, probably in next 1 or 2 days, and compile your things, compile your cases, document your cases, and you can share with us. I do a lot of mentoring with all my participants whoever come with our workshops. We want to make them further learn, after even they finish that workshop. So we
Right.
guide them as well. So I always say when you finish your workshop in next 1 or 2 days, you should be able to do one or two cases and learn that knowledge what we have learned in that workshop and apply in your on your patients, correct? So and it's as I mentioned, you have to keep learning. We are guiding you, we are telling you, we are giving you a lot of information, but you need to put more efforts to make yourself better.
Right. And since when a doctor is practicing, there are a lot of scenarios wherein, I believe good practicing is a brand building exercise as well. because if you treat a patient well, the word of mouth and the more patients it will draw to you, that will ultimately be maybe a test of credibility of how good a doctor is. So what advice you can give to doctors in brand building, how they should make their brand?
Okay, so I don't know I should answer this way or I keep it very simple, Ansh. Basically, always feel you do your best, whatever your intentions, your intentions should be pure. You should always think about your patient and do your best for your patient and forget about everything. Brand will only be always build. I believe in that. I feel you don't need to do so much of work in brand building if you're true to your patient, if your work ethics are good. Honestly, day by day, it will take some time, but it will build up. I believe more in that rather than putting advertisements or showing. I do a lot of work, but I don't show. I don't know whether you know my social media accounts.
Hmm.
I think the amount of work I do, probably I don't even show 1%. It depends. Again, everybody is different. I'm not telling that you should not do that. Everybody is different. Nowadays, because people wants to see you, yes, things are changing, but I still believe in one thing which I have learned from my teachers, from my gurus, whoever has taught me. I think do your best, do best for your patient, and things will come in place.
And with the increase in social media and the use of social media in everyone's daily life, I believe a personal branding actually helps calms the anxiety. Because taking the scenario, if a patient is in maybe, let's say, an OT or is undergoing a procedure, usually the family members are looking up who is the doctor. And if they do not find much information about the doctor or their, accomplishments on the internet, they may feel like whether he is credible enough, because it is actually the patient who is conversing with the doctor at that point. So, what do you think? What can be put out on the internet to build that credibility?
Okay, and so as I mentioned, see when you're working, like for me, like it's been almost now more than 15 years. Like I think I have built up my CV. Correct. I have done a lot of work. You can see my name as well. The things what I have done. Yes, so it is there on because like I'm working in University of Queensland, so my CV is there. Correct. So you can go and see that CV. Correct. So people understand, but I don't believe that you need to. I don't know. Again, sorry to say that words, but I don't like doctors making that stupid reels and downgrading your profession. I don't believe in that. I don't think that you need to do all that to attract patients. I'm not like that. So I still believe if you're working hard, you're consistent. And I feel the most important thing is consistency. It's not one day thing. It's not 2 day things. You need to be true to your profession. You need to be true and honest to what you are doing. I feel things, again, as I mentioned, it will come.
Got it.
People know you. It's not that people don't know. People know you. People know everything.
And if some, and also there are certain doctors who have an aspiration of a global aspiration, per se, if they want to transition from one country to another. I believe visibility among the community itself is an important factor if you want to transition from, let's say, one private job to another private job. So, how do you feel like transition from, since you have done it twice, from India to Malaysia and then now to Australia, how does that journey takes place? So, how a doctor who is practicing in one particular country can train themselves, or how what can be their objectives if they want to transition into some other, maybe a third world country?
Yep. So Ansh, again, the question comes back to you how you build up your CV, correct? So the important thing is like, because if you're doing something, document your things, correct? You need to have your documents ready, you need to have a good CV. You should don't make mistakes in your CV, spelling mistakes, comma, basic grammar, don't do that. LinkedIn, yes, we have different platforms. Even I have everything. I'm on social medias also. I'm on Instagram. I'm on LinkedIn. I'm on Facebook. But what I'm trying to say is, yes, you can put your things, but you don't need to do funny things to build up your uh, probably your presence to show to a people. No, you can put your credible things, like that. Okay, you have done good workshop. You have learned from someone. Yeah, you have conducted a workshop. No point. Please do that. It will help you. People see. I know you what you are saying, and you are right. Like people see your profiles. They want to see how you have done. Like if you see my LinkedIn profile, even I have put my CV, even I have put where I have worked, my education, whatever I have done so far. So I have put posts, like I have put some kinds of my root canal treatments, what I have done, some certification courses, what I have done. Yes, you can do that. It makes sense because people is going to see you. I totally agree. But again, like, I have learned many years back, so whatever I'm doing, I keep on adding those points in my CV. So I keep on editing my CV. So I don't keep my like, things for last moment, so if I have done something, I will add today. Maybe I have done something in next 2 weeks. Whatever I've done, I will put that. So keep on building your CV. It will take some time, but if the opportunity comes one day, you are ready to.
Grab the opportunity.
So if your CV is strong, you are building up every day, you know what you are writing, you are doing a credible work, you are probably showing few things obviously in a credible way. I think this is what is required.
And if we have to, well, moving apart from this topic, if we have to rate the doctors across the world, which country has the best dentists?
Again, Anshish, I can't say best because every country. I've not been to many countries. I know so many people from different countries. I think everybody is good. I know so many good dentists from US. I know so many good dentists from Australia. I know so many good dentists from India. I know so many good dentists from Malaysia. So again, it's you can't say, okay, if I'm from that country, you are the best. No, it doesn't work like that. Yes, I see people have that kind of perception. Oh, if it's from third world countries, they are not good people. No, I don't agree. Like, I'm in Indonesia right now. There are so many good dentists. I know them. They're doing excellent work, excellent clinicians. So it's very difficult to say that. Uh, Again, it's not a right way to say that, okay, from this country, they are the best. No, I won't say that.
Okay, so maybe I can rephrase this question. Which country is more accommodating towards dentists and has a better culture for the dentists to be in?
Okay, so I think basically the rules and regulations are different from different countries. Like I'm working in Australia, the rules are very strict. So very strict means that we have different bodies. So Australia body, the dental body which controls, they have a very strict rules, which is good, because it's ultimately protecting people. So if a dentist know the rules are very strict, they'll be extra cautious, correct? So all these countries like Australia, US, Canada, UK, New Zealand, all the rules are strict, which it should be that way. You need to make sure that you are constantly learning. You are compiling your CPDs. You're making sure you have updated registrations. You are doing your CPR courses. You have your basic knowledge about medical emergencies. All these things are very critical so that you can actually be a better dentist, better clinician, and you can do probably a better work with your patients.
Got it. And since you have worked with a lot of different patients, you might have seen a lot of bad dental habits. Like some patients might have, certain teeth which are, you know, very difficult to convince them, please don't do this. So, what are the worst dental habits a person can have and they are continuously having which they shouldn't have?
Okay. So I think the this advice I've given to almost all my patients means this is my standard line. What I say, God has only given us two teeth, two set of teeth. Okay. One is your primary teeth or your milk teeth. Okay. When you are a small child, you have that deciduous dentition, or we call it milk teeth. And then comes your permanent dentition, permanent teeth. So God has only given you two set of teeth. And I always say if you don't protect or don't take care of those teeth, third set is very expensive. Correct? Yeah. So the simple answer is you need to take care of your teeth, correct? And people don't realize that everything starts from mouth. Agree? Everything starts from mouth. Whatever you eat, you have to eat from mouth, and it goes to your system, correct? So if your mouth is not clean, basically your body, you're taking all your bacteria and everything inside, correct? Which is not good. So everything starts from your mouth. So the most easy way, most simple way is you have to brush twice a day. Okay. You have to rinse your mouth after every meal. Okay. You have to floss at least once a day. Okay. And you need to see your dentist every 6 to 8 months for basic simple cleaning. Correct. If you can't do it in 6 to 8 months, at least once in a year, once a year. So this is something very, very basic. There cannot be anything less than this. Unfortunately, people don't follow. So where they don't do it, they won't brush twice a day. They will never use floss. They won't go to the dentist for basic cleaning until they have some issues,
Some problem, yeah.
some problem, basic, they will have pain, then only they'll wait, they will wait, they will wait. So ultimately, you are delaying it, and ultimately, you need to go to the dentist, correct?
Right.
To keep it as simple as possible, as I mentioned, just follow these simple rules. So if you follow these simple rules, you'll be fine.
And what is the difference between, flossing and brushing? If someone is brushing their teeth twice a day, where is the need to floss?
Okay, Ansh, basically when you brush your teeth, you can brush most of the areas, but if you see, there's a like a sort of a contact between teeth, correct? So your brush cannot go there. Okay. So to clean that area, you need a floss.
Okay.
Otherwise, all areas, you can brush. But between those teeth, it is difficult because the brush bristles cannot go there. So to clean that area, you need a floss. Because if you don't clean that area, so there's a layer called plaque. It will get deposit, and ultimately it will, after a few weeks, it will change to something called calculus. And once it is
Okay.
formed, you cannot remove it yours. You can remove the plaque yourself, but you can't remove calculus. So we don't want this plaque to convert into calculus,
Okay.
and this plaque forms within few hours. So like if you brush your teeth, in next few hours a new layer will be formed. So what my role is to remove that layer immediately. Like I every time, if I brush every day, because it's not going to get changed to calculus in one day. It takes time. If I brush every day, if I floss every day, I can remove this plaque easily, correct?
Got it.
So
And
that's simple.
there are also certain people who brush very, aggressively, either using some, very hard bristles, and they are brushing aggressively with the same intention of removing the plaque. That so is it right or is it wrong? Is it a right practice?
It's absolutely wrong. We don't need to do that. Okay. We need to use a soft bristle, and we need to go do gently. We don't need to do it like that. No, you're going to damage your teeth. You need to damage the outer covering of the teeth. So you need to be very gentle. There are few techniques. The most easy technique, you can use a rolling technique. Okay, simple rolling technique. Or what you can do is we take a bristles brush and we keep it around 45 degrees, slightly closer to the gum area, correct? And we do a small strokes everywhere. So you need to spend around 2 minutes minimum 2 minutes in brushing your teeth. So these are something very simple, basic technique. You don't need to do aggressively. You're going to damage that.
And there is a lot of new trend of electronic toothbrush coming in. So what's your take on electronic toothbrush? Are those actually very effective, or the traditional toothbrush are, you know, good to go? There's no absolute need to switch from a normal toothbrush to electric toothbrush.
It's nothing wrong in using it. It's something like a technology, you can say that. It's like a small gadget for you. But evidence doesn't say that, okay, if I don't have an electric toothbrush, I can't do a good work with my normal brush. I can still do it. So if you're lazy, probably you need probably electric toothbrush. Nothing wrong in using electric toothbrush. Nothing wrong. It's just an extra cost or extra gadget you have it. Yes, you can do it. But again, as I mentioned, if you know the right technique, if you understand what you're doing, you can even use a normal toothbrush.
Right. And also there is one common practice which, everyone, like, people waking up without brushing their teeth, they either have a sip of coffee or chai or tea. So what do you feel like, which are the right foods to have in the morning for a good dental health, and which are the absolute worst to have in the morning, which deteriorates your dental health, but people don't know about it?
Okay, Ansh, basically, what we recommend is see any food which is acidic. Okay, so like example, anything which is acidic can damage your teeth, or or sugar. Too much of carbohydrates or too much of sugar can damage your teeth, can cause some problem. So to keep it again very simple, I get up in the morning, because throughout the night, 6 to 7 hours of sleep. So when a person is sleeping, the brain is also shut down, correct? And the brain controls these glands. So you have a lot of glands around it.
Right.
These are called salivary glands. So that produces saliva. Okay. So since you were sleeping, your brain was shut down, your salivary glands are not producing too much of saliva. So your mouth is more dry. So when the mouth is dry, there is more action from the mouth bacteria to cause some harm. Correct. So when you get up in the morning, the first thing, obviously you can rinse your mouth and you can brush your teeth, because last 7 8 hours, there was a lot of accumulation of plaque. Correct. Do you agree? You understand? And after that, you probably start with your breakfast, whatever you eat. Correct. Try to avoid anything which is very acidic. Okay. I'm not stopping you to not to take your tea or coffee, whatever, but
Hmm.
obviously it depends upon people to people. But if you're taking it, you can rinse your mouth after that. Let's suppose I had a something which is a bit of acidic. After that, I don't want to brush it immediately. I will rinse my mouth with simple plain water. Correct?
And
Are you
can you
getting
tell
what I'm?
what are acidic foods? Like, can you give examples of what acidic food?
See, basically, let's keep it very simple. If you take too much of sugar or too much of carbohydrate, correct? So, as I've told you, the plaque will be formed, correct? They will stick to the teeth, correct? Now, this food will release that acid, correct? Okay.
Right.
Now, this acid will, so basically, the acid is lactic acid. It is going to start causing some kind of damage to the outer covering, correct? So, if the food is too acidic, so every food will be converted to some kind of acid. But if you're in the beginning only you are taking too much of acidic food, like you can say any citrus fruits or any food which has a very low pH, okay, it can cause more harm. But otherwise, even if you're taking a normal food, which it will ultimately convert to that acid. Are you getting it?
Right.
Carbohydrates, all sugar, they get converted to acid, and which can cause some kind of harm. So it doesn't mean that you can't have it. You still can have it, but you need to understand that after your meal or what, you can just do a simple rinse with plain water, so that it doesn't, so it will neutralize that effect.
Okay. So have you ever encountered a patient who might not have brushed like for a couple of months, let's say? So what happens to them if someone does not brush at all for a couple of weeks or let's say months?
Obviously, there will be a lot of accumulation of plaque. There will be a lot of accumulation of calculus. Yes, I have seen patients. So I don't know, one patient I met has that. He said that somebody told me if I brush my teeth regularly, aggressively, I'm going to damage. So it's better not to brush. I'll just rinse with my plain water, which is not right. Correct. So I have seen patients, yes. So there's a lot of accumulation of plaque, a lot of calculus deposit, which is not good, because if that layer keeps on attaching to the tooth, ultimately it's going to demineralize, it's going to damage that outer covering. You can have some kind of caries or a decay or a cavity. It will start as a small cavity. Ultimately, if you leave it like that, you don't do anything, it will become a little bit bigger cavity. It will go further down. So basically, a tooth has a three layers. One is the outer covering called enamel, then you have a middle layer called dentine, and the third layer is the one which is more sensitive, which has a nerve. So if you delay all these things, it will keep on damaging the middle layer and then the inner layer. And then you will have pain, and then you will come back and rush to the dentist.
And what's the most complex patient you might have encountered? Some kind. What's the weirdest thing you might have found in a tooth? This is very extreme example which you had.
Again, many examples. I have treated one tooth which is completely rotated, 360-degree rotated.
Okay.
So a bit surprising. That time, when I saw, I said the nerve should be here. Then why it is here? So it was completely rotated. But like that, in my branch, we encounter many different kinds of anatomies, which is always a complex and challenging. It should have three nerves, but it ultimately turns out to have four nerves or even five nerves. Correct. So becomes very complex. Some teeth should have one nerve, but turns out it has two nerves or even three nerves. Correct. So my field is very complex. Every day we see a lot of complex morphology, complex anatomy. So we need to deal with that. There are a lot of examples I can give you.
What's the one craziest one which you were also shocked? Like, yes, it was your first time. Something you might not have heard before or experienced before. That one.
Again, Ansh, there are many, like as I mentioned, five canal or a four canal or four nerves in a tooth, which I have not seen for many, many years. Suddenly I see, after many years, or, the weirdest thing I have done is, okay, if I remember, upper second molar, correct? I took it as a normal case. I thought it's a straightforward case. It turns out to be C shape, complete C
Okay. What is a
inside.
C shape?
It's like a C. Inside it is C, so the nerve is C. Okay.
Okay.
So little complex, because upper second molar, that was my first case where I have treated second molar with a C shape anatomy. Though in our literature it is there, but I have never encountered. So that was first case for me. Challenging, yes, very challenging. I need to stop because I was suspecting there's something not normal. I need to stop, take a CBCT and diagnose it. Very complex, yeah. It took me a lot of time to find that nerve, to understand, to clean it. So very challenging. So yes, like that, as I mentioned, we see different crazy curves,
Hmm.
crazy anatomy, very long. I have treated upper second molar 27 millimeter, which is not normal. Normal length is like 21 millimeter, 22 millimeter maximum. 27 millimeter upper seven. Rare, very rare. Uh, canine, the canine, the corner tooth. Average is 26.5 or 27. I have treated 32 millimeter.
Okay.
Okay. So uh, complex cases are we see every day.
And if you have to tell what's one of the biggest lies which people still believe about root canal, what would that be?
Okay, the biggest lie I feel is some people in some parts of country, they feel that uh, if they get the root canal treatment done, they will have some other issues. Okay, this is something like a myth. So, which is absolutely wrong, absolutely baseless. We have so much of evidence that that root canal infection doesn't cause any other issue. It is localized, it is there. But still, some people think, if they get so they just want to extract the tooth. They want to just remove the tooth. They don't want to get the root canal treatment done, which is very surprising. So basically, we are saving the tooth. We want to do a root canal treatment to save your tooth. We want to preserve your tooth. We don't want you to extract the tooth. Okay. So if you extract the tooth, it is gone forever. Gone. Correct. Then you need a third new set of tooth. You probably need an implant or whatever. So our branch is basically to save the tooth. So sometimes some patients come with weird ideas. They read that, some news from somewhere. They read some documentary. They see some documentary or wrong information on Google that if they get the root canal treatment done, they will have some other issues. So we get weird kind of patients. Yeah.
And what's one common mistake usually endodontists make while treating root canal?
The common, I think I always say that you need to understand your case first. Before starting your case, you need to understand what's my diagnosis and what's the anatomy, what's the morphology of that tooth. So I think the biggest mistake people do is they want to rush. They want to immediately bring their instruments and start doing, and then end up getting a lot of surprises. I think the initial part, initial diagnosing and understanding your case is very critical.
And if you have to give an advice for the upcoming dentists per se who are currently in maybe in school 11 to 12 preparing for competitive examinations or either pursuing their MBBS, what would that be?
I think the advice which I can give to young people is you need to show consistency. You need to learn. Every day is learning. We, as a doctor in a medical field, you can't say, okay, I have completed 9 years, done. No. We need to keep on studying. Yes, as I mentioned, everything is changed. The new things come, the new evidence comes. So it's a continuous throughout you have to learn. Okay, number one. Second thing is you need to have patience. Things not going to work immediately. So we always, like my time, we always say, okay, a doctor or a dentist need another 4 or 5 years to establish himself or herself, correct? So it takes some time. And if you are passionate, as I mentioned before, you need to show that dedication. You need to show that commitment to this profession. It's a noble profession. And if you ask me what I want to be in probably my next life, I want to be an endodontist again.
And so, as a doctor, do you believe in God?
Yes, I believe in God.
Usually, a
I
lot of
strong.
doctors, usually a lot of doctors or people into sciences are, on a contradictory belief that either God is there or everything can be proven by science. So, what's your take on that?
I believe in science. Definitely, I was a science student. I am a science student. I believe in evidences. Yes, there's nothing wrong in that. But I still believe in God. I believe there is a strong power. There's a strong universe which controls a lot of things. So I'm a very firm believer in God. For my
Got it.
every case so far in 16 years, how many I have done. That's the one line I always say, and I learned this from my uncle. I think I remember in his clinic he has written, "We treat, he cures." You understand?
Right.
So I
It's
still believe
always
in
the God curing.
we, like, I don't know whether people will take it in a different way, but I always say that we treat, he cures. So I'm a firm believer in that. I believe there is a power, there is but it doesn't mean that I'm diverting from science. No, I still believe in evidences, but everybody is different. I'm not saying that if what I'm thinking, you also have to think. Everybody has their own way of thinking. Yes, I believe in God. So in simple way, yes, I believe.
All right. Thank you so much, Dr. Shekhar, for giving us time of the day. It was lovely hosting you. So, before we close the podcast, any closing words you would want to have and give it to the audience?
Again, Ansh, same thing. Even to you also, keep learning. Don't give up. Whatever you want to do in your life, please do it. Follow your passion. Show commitment to your profession, whatever you're doing. Be humble. Be grounded. So success and failures will come. If you're getting success, don't fly high. If you're getting failures, don't take it in your heart. Correct? Every day can't be a good day, but every day can't be a bad day as well. Correct? So I just did my presentation, and I put my last slide as maybe it will motivate people. So if it's raining, correct, I'll try to find a rainbow. Correct. But if there is a darkness, I'll try to find stars. Correct. So I am a believer in that. I think that's how I am. Uh, and I'm still learning. There's so much to learn. That's the only advice I can give. It's 2:12 a.m. here. That's the best I can think right now.
Well, thank you so much. It was lovely hosting you.
No problem, Ash. Thank you. Thank you for calling me. Thank you for inviting me. God bless. Keep learning.